Chances are you've heard of a hernia. Maybe you've had one or a loved one has. But do you know what's behind that bulge and what to do about it? Let's take a look. Deep inside our bodies, our organs are surrounded by muscles and tissue that hold them in place. If those structures are stretched, weakened, or damaged, neighboring organs can push through. That causes a hernia. Hernias usually form in your abdomen, groin, or the lower part of your chest. They may seem to come and go, and they can be painful. There are several common types of hernias. Inguinal hernias happen when a part of your bowel pushes into your groin. You may notice a lump in the crease between your abdomen and thigh. Hernias can also be a side effect after having abdominal surgery. The incision site can weaken over time, allowing tissue to bulge out. Those are called incisional hernias. About half of people over the age of 50 will experience a hiatal hernia. That's when the top of your stomach pushes through an opening in your diaphragm. You probably won't see or feel a hiatal hernia, but you may experience acid reflux symptoms like heartburn, indigestion, or a sore throat. Belly buttons are also common hernia sites. They happen when your intestines push near your belly button and cause it to stick out. It's called an umbilical hernia and is often something you're born with. Most hernias aren't emergencies, but some may require surgery because over time they can get bigger, more painful, and in some cases cause tissue death. Hernia surgery is typically a quick and effective procedure, and it's very common. Surgeons around the United States perform more than 1 million hernia surgeries each year. If you suspect you have a hernia, talk with a healthcare provider, like a primary care physician. They can diagnose the condition and can talk with you about your options.